Hello guys, my name is Jasmine Johnson and today I will be discussing communication between healthcare providers, patients, and coworkers in the medical field. Communication between healthcare providers and patients is very important because it allows providers to be able to make a proper diagnosis for their patients. It also allows the patients to be able to receive the most effective treatment and most effective care plan based on the information that they give their provider. Communication between healthcare providers and coworkers is also very important because teamwork can be used in difficult situations. In this video, I will discuss the various ways that communication is used to place effective roles in healthcare. In 2018, Allison Dodge wrote an article titled Types of Communication in the Care Setting. Her article described the ways that healthcare workers use verbal and nonverbal communication. Patients use verbal communication to explain to their provider the reason for their visit as well as symptoms that they are experiencing. Patients may also use verbal communication to explain to their provider any concerns that they may have. They may ask the provider to elaborate a little bit more on what they are trying to explain and describe. The patients may also express how long their symptoms have been going on for and why they feel the way that they feel. Providers use verbal communication in order to get a clear understanding of what the patient is trying to explain. In doing so, providers may also ask additional questions to gain clarity based on what the patient is trying to tell them. In 2010, an article written by Michelle O'Daniel and Alan Rosenstein titled Professional Communication in Team Collaboration describes responsibilities of healthcare providers as well as the way providers communicate in order to work as a team with their colleagues. In 2018, the MedPro Group published an article titled Nonverbal Communication as an Essential Element of Patient-Centered Care. This article described the use of nonverbal communication through body language. Appropriate body language allows patients to feel secure, which ensures that patients can trust their provider. Appropriate body language forms a positive relationship between both individuals. An example of appropriate body language that the provider may express would be through using good eye contact, sitting up straight, remaining engaged with the patient as they explain their concerns or as they try to explain to their provider their symptoms or what may be wrong with them. Therefore, it is important for the provider to use these tactics because it can help the patient relax a little bit and open up to their provider a little bit more. Now that I have discussed how healthcare providers use verbal and nonverbal communication, I'm going to discuss how they use written communication. An article titled The Importance of Documentation in Healthcare, written by Karen Madrid in 2016, describes the way documentation plays an important role in healthcare for patients and providers. In this article, Madrid stated, for patients, documentation ensures the delivery of safe, consistent, quality healthcare. Healthcare providers communicate with patients and coworkers by transcribing information, filling out the patient's chart, and maybe writing down any additional information that the patient might have told them. Healthcare providers use written communication when documenting patient care and documenting symptoms that have been presented by the patient. Documentation also ensures that providers and coworkers are able to keep track of patient care as well as what was administered to the patient during their visit. Now that I have discussed how providers communicate using written communication, I'm going to discuss how they use visual communication. Visual communication, written by J. Martin in 2015, elaborated on how visuals are used in healthcare for patients. Providers may use visual models to convey messages to their patients. This will help the patient better understand their condition and the severity of their condition. It may also help the patient get a little bit better understanding of where their condition may lie on their body. Visual models are often used to help the patient get a better understanding of everything that's going on with them, and basically just allowing them to be able to physically see where it could be on their body. Throughout this video, I'll discuss the various ways that communication plays an effective role in healthcare. I also discussed the 4 ways that communication is used. These 4 ways include verbal communication, nonverbal communication, written communication, and visual communication. It is important for people to know that communication between healthcare providers, patients, and coworkers is essential in making a diagnosis, formulating a treatment, and creating a care plan for every patient. This allows healthcare providers to be able to make the best decisions for their patients and create treatments that will help the patients in the best way possible.